Joining us now, Dr. Jeff Potoff, UW Health's Chief Quality Officer. Doctor, great to see you. President Biden recently said the COVID-19 pandemic is over while he was on CBS's 60 Minutes, and those comments got instant backlash from some. So we have to ask our UW Health doctor, what say you on the pandemic? Is it over?
Yeah, I think saying that it's over is probably just a step too far. Certainly, his other comments on the situation that we're in right now with cases, fairly low, lower than they've been before, hospitalizations lower. Things are definitely looking brighter. We've got medications available, boosters available. But to say the pandemic is over, which means, it's not causing widespread problems both here in the United States and around the world, I don't think we're quite there yet. Better language would have been, light at the end of the tunnel, almost there, but over, probably stretching it.
Yeah, 400 people are dying a day in our country. On average, I just looked at the numbers. 5 people died every day this week here in Wisconsin. But in other regards, it does feel like things are back to normal. I went to a Brewer game last weekend, and it felt like a Brewer game. So it's kind of this weird juxtaposition that I'm sure the president's even in when we're discussing where are we right now in the pandemic.
I agree, because things do feel so much better, and it almost highlights just how bad they were when we were going through the pandemic. It still sounds awful to hear the numbers you just quoted. Go back a year, I'm sure those numbers were much worse. And
you were saying, part of the reason maybe the president's saying things like that is because we have things like vaccines and booster shots. I want to ask you about this new booster shot that targets the Omicron variant. So it's available right now, but I want to ask you about when the best time is to take it. There is some discussion on this. We know that the boosters, they work best right when you take it, and then they start to wane a little bit, right? So there's been discussion, should I get it now or should I wait maybe until, October or November, where in the past couple of years, we've seen COVID cases spike?
Yeah, I think there's a few ways to look at this. So for sure, if you're older, say age 60, 65 or older, and you're due for a booster, I would get it right now. I wouldn't hedge my bets on not catching COVID until I get boosted. And we know that these boosters have a benefit in severity of illness and even death. For the rest of the population, there isn't much harm in getting it right now. You get that protection. It will for sure last the next 2 to 3 months. You won't be too bad off. If you choose to wait, some people say, hey, cases are down. Maybe I get it a little bit later, covers me better for the holiday. That isn't an unreasonable approach, but it does increase your risk a little bit between now and then as far as getting COVID, being out of work for a week, suffering those consequences. So not a clear black or white line there, but for the most part, if you're kind of questioning it, I'd say go get it right now.
Yeah, or talk it over with your primary care physician and have that conversation. I want to ask you, it is flu season, and your hospital's reminding people you can actually get the flu shot and the COVID booster at the same time. Can you talk about the advantages and disadvantages of doing that?
I think the advantage of it is it's just one trip, right? So if you go to get your COVID-19 vaccine, you can get your COVID vaccine in the left arm, your flu vaccine in the right arm, and then you just check those both off the list, you're done. If there's any harm in it, not so much harm, but flu season isn't hitting us too hard yet. Folks who would wait, a couple of weeks, they may match that flu vaccine and that immunity they get from it a little bit better with the flu season if they waited, say, 2 to 4 weeks. But then, you're looking at maybe getting 2 shots on 2 separate days rather than getting both shots on the same day. So typically the recommendation is just get it done at one time. It's easier. Then you don't have to worry about it.
I like that advice. Personal question. Do you get them both in one arm, or you do one in one? For
no,
you?
One in each arm. That way, both arms are equally sore the next day.
I like that thinking. Dr. Jeff Potoff from UW Health. Appreciate your time.